912 Daily Show, and with our friends at OSF Healthcare. Did you guys have a good Super Bowl?
Absolutely.
Yes.
Good. I slept. I'm really glad we do these segments, though, with OSF. Each and every time we have you guys on, it's a really important topic, whether or not we're talking about some great recognitions that were awarded, like the Magnet with Distinction this last year, and great updates in imaging and great new machines and innovation coming in, but also just awareness months like Heart Month. And thank you guys for joining us today. It's a pleasure having you back on the show. And where should we really start when we're talking about February and just taking care of all things, when it comes to the cardiac system?
Yeah, I think February is just, it's a great month to just showcase heart health awareness and, get the information out there for people to know their heart, know their risk factors, and know that we provide, heart health testing right there in your backyard.
Absolutely. And, Fred, whenever we had you on the show last, we were talking about some of the CT imaging that was coming into OSF. And also, I'm going to be talking about today a little bit more of that in a different way. Fill me in on this.
Sure. So with the new equipment also brought some additional technologies and additional scans that we could do. So one of those is coronary testing. It's a CT scan. It looks at kind of those main vessels around your heart, and it gives us an idea if there's calcium, if there's blockages, things that cause heart attacks. So it's called a CT calcium scoring or a cardiac scoring, and it does just that. It scores your heart and what's in those vessels. So it's a really quick test. You don't get any IVs. It's not painful. It takes about 10 minutes. We hook up some EKG leads. It scans your heart. It's a really quick scanner, so it scans between heartbeats, which is really cool. Some neat technology that goes along with it. And then we do some workup on it, and it tells us how much calcium's there, and it gives us a risk factor on if you're at risk of having some cardiac issues in the future. So we look at is it right for you? So are you a smoker, or do you have high cholesterol, or do you have a sedentary lifestyle? Do you sit kind of in a swivel chair all day? Kind of those things we look at, and if any of those things are you, the test is right for you. You can talk to your doc, get an order. We can get those done within probably a week or so. They're pretty quick. And another bonus, they're cheap. They're like $120-ish.
Wow.
It's looked at by a radiologist, and it gives you those ideas. So it's just a really great test, and it's great to have before you start having issues.
Well, and, heart health is something that affects so many of us throughout the country and so many of us in our own homes. Take me through, really just the impact in that, our cardiovascular system, our heart really does have on us. How many people does heart issues affect when it comes to, just everyday Americans? Is it quite substantial?
It is. And I think what people don't realize is that it is the leading cause of death for both men and women.
Wow.
Above cancer.
Really?
Yes. And I think women, it's a little bit tricky, and it's important for women to, it's easily dismissed, or the symptoms are a bit more subtle than men and kind of your classic typical symptoms. So, women, it's very important to not blow anything off and listen to your body and trust your instincts.
Well, and a question for you. I know that just talking with some of the providers from OSF, I've asked before, just, some of the younger people that are maybe experiencing some, heart issues. And have you seen that just from your side of things too? Oh,
yeah. I think with our diet, less active lifestyle, and then, excessive alcohol intake and tobacco abuse really have kind of launched the cardiovascular risks in today's time.
It's not just a young person issue, or an older person issue. Yeah. It absolutely happens in young people as well. And you could be a runner and have the issues. You could, there's anything. There's just as much genetics as family or as lifestyle that goes in with it. So like Keely said, it's important to listen to your body. And if something feels wrong, there's something wrong. Get it checked out. So
that's so important, because so many times I just talk about, the obvious, which is, maybe the cigarette smokers or the 4 energy drinks a day and not drinking any water or whatever that does to you. I don't know, probably not very good. But, some of the lifestyle issues. But we don't really talk a little bit more about the genetic side of things, and
Absolutely.
just as important. And that comes back into this test that we're talking about today too, correct?
Yeah.
it does. Absolutely. If you've got family members that have had cardiac issues, have had heart attacks before 50 or things to that effect, if you've had any family members pass away from cardiac issues, this could really be a lifesaver.
Mm-hmm.
Well, and how do we sign up? What's that process look like as we still are on this topic?
Yeah, absolutely. So you just need an order from your physician. So it doesn't matter whether you have an OSF physician or anywhere else.
Oh, that's nice.
You can get that prescription, just like you're getting medication, from your doctor. You can call our scheduling hotline, 474-4606, and get in and see us. It's very quick and easy, and we get you taken care of. You have results within the week.
And before we take a break here in a couple of minutes and come right back to it, are the symptoms the same, when it comes to, heart issues for both genders? Or does it depend on what we're experiencing, number one, whether it's a heart attack or a stroke or anything like that, or just maybe some premeditated issues? Do the symptoms weigh out to be the same, or does it just depend on the person?
I think going back to women being a little bit more subtle, I think, women traditionally have not presented, with the crushing, stabbing chest pain, the jaw pain that radiates down the arm. It's a bit more subtle. And, I think women, just to speak on that, natural caregivers, and will often put somebody else's needs above their own. And so, tend to kind of blow things off, or we'll try and start ruling some other things out before looking at their heart. I do think that's changing. Mm-hmm. I think we're, trying to close that gap a bit more, but it's still very much, a prevalent bias.
How early does it start to really maintain, our overall health and tying this into, our hearts too? Because, I'm 27 years old, but, does it start as early as that, just getting baselines and just knowing where I'm at younger, or, at this age? Or when should we really start paying attention to this?
Really depends on your genetics, who you are and what you do. That's always a great thing to discuss with your physician on, I feel a little bit different or whatever. So it's really personalized person to person. It really outlines why you should have a great relationship with your provider and see them on the regular. There's a lot of folks. I myself, until I was in my 30s and even in my 40s, I didn't see a physician regularly.
Really? That's fascinating.
You really, really should, starting early. So there's a lot of things that can be kind of headed off early if you have that relationship.
Absolutely. You guys got a moment to take a quick break?
Sure.
Absolutely.
We're going to pay a bill, $9.21, a little bit of change. We're going to come back. More of this great conversation awaits you right after this on RiverBender.com, Roku TV, and if you listen to it later on Apple Podcasts.
Struggling with depression that just won't go away? At Precision TMS, we offer a non-invasive, drug-free treatment designed to target the areas of the brain linked to mood regulation. Using FDA-cleared transcranial magnetic stimulation, gentle magnetic pulses help reactivate underperforming brain circuits without surgery or sedation. Many patients experience real relief, even after other treatments haven't worked. Our experienced team provides personalized care every step of the way. Contact Precision TMS today to see if TMS therapy is right for you.
Accidents happen in a heartbeat, but lives change forever. Whether it's a car crash, workplace injury, medical malpractice, or wrongful death, you don't have to face the consequences alone. Keith Short and Associates brings over 33 years of experience and a reputation for fighting fiercely for your rights. For relentless representation that you can trust, call Keith Short and Associates at 618-254-0055 today for a free consultation.
Do you need to declutter your space? Time to call me, the Queen of Junk. Since 1993, we have grown to be the leader in residential, commercial, and property management junk removal. At Sparks Junk Removal, we are eco-friendly. We recycle, donate, or repurpose items back into our community. Trash is our last resort to the landfill. Plus, with our all-inclusive service, our crews handle everything from labor to lifting and landfill fees. Give us a call or visit our website, sparksjunkremoval.net, to reclaim your space today.
Macias Insurance Agency, providing quality products with extremely competitive prices. As an independent provider, we source multiple companies to offer the best rates possible, covering auto, home, business, and life insurance. Our goal is to provide quality service that meets and exceeds customer expectations. You can rest easy knowing the Macias team is working round the clock to ensure that both you and the most important parts of your life are covered. Our qualified professionals make the insurance process easy so you can live carefree and focus on what matters most. Visit MaciasInsuranceAgency.com today to find out what our team can do for you.
What's up? It's Mike Keith. What's up, bro? What's good, my guy? Back to spotlight other amazing alumni and how they discovered their path at Lewis and Clark. Let's jump into it. This is Dwight Wirtz, president of Wirtz Welding and Tank Service, the nation's premier distributor of tank trailer parts. Dwight has been an outspoken and long-time supporter of the college and is the current chairperson of Lewis and Clark Board of Trustees. Oh, and he's a Lewis and Clark grad.
I'm Dwight Wirtz, and I am a trailblazer.
Throughout all life stages, you need someone in your corner, guiding you on your health and wellness journey. At OSF Healthcare, that's your primary care provider. Your OSF primary care provider is there for every stage of life. Find a provider today at osfhealthcare.org/primary.
A little bit of change. Our friends of OSF Healthcare back with us. Well, going back in just this conversation, getting to know you guys a little bit more. Fred, I know that we talked to I think it was it last year? Was it?
It was.
Well, it was last year. Now we're in 2020. I keep forgetting that. Did we talk once or twice last year?
Just once.
Oh, man, my memory's getting bad. Well, take us through just a refresher of your role with OSF real quick, just to familiarize yourself with our audience.
Sure, absolutely. So my name's Fred Sansucci. I'm the Director of Imaging Services. I've been with St. Anthony's not quite 15 years now, kind of rolling up close to it. So I have under my scope kind of everything that you would think of regular imaging, radiology and mammo and nuclear medicine, MRI, CT, things to that effect. We also have neurodiagnostics, so that's EEG and EMG. And then actually at the beginning of this month, I also expanded a little bit, and I'm Director of Sleep Services now at the hospital as well. So just kind of those diagnostic things.
Really important. And, Keely, going into your role a little bit, just to familiarize yourself with our audience.
Yeah, so I'm Keely Nelson. I'm the Director of Critical Care and the Cardiology Service Line. So I have kind of the ICU and respiratory, as well as the diagnostic testing for cardiology, echo, EKG, stress, and then, you have stress.
We share stress.
We share.
I bet.
We share a hallway.
We do.
And then also the cardiac cath lab, where our procedures are done.
Mm-hmm. So you guys work, I'm sure, in conjunction quite a bit.
Yes.
We do, absolutely. Quite a bit we work together. And that's part of the great team that we have at OSF St. Anthony's. We've really got some great teams. We don't worry about stepping on each other's toes, because really all we care about is taking care of the patient.
Accomplishing the goal.
Really all that matters to us. So.
Well, and right following that too, OSF's partnerships throughout the region, it seems like, are really helping the equation too. Take me through the SSM affiliation real quick.
Yes, that is a fantastic partnership that we had completed a couple years ago, and it has since just grown tremendously with adding more provider services. I think for the biggest thing to note for our RiverBend community is that river just outside this building. A lot of people don't like to cross the river.
True.
So kind of bridging that gap with community medicine, bringing some of that academic level expertise over to our community has been fantastic.
Well, and I'm sure, you hear that from so many individuals, is just bringing that over and not having to drive the 45 minutes or the hour. And, especially for folks that are older and maybe that's their only way to transport over there, it's great to see those additions coming and partnerships that elevate that. And going back into this test real quick, do I need to take off work for the calcium score?
Just if you really want the day off. No, not really.
Don't give me that option.
You come in, it takes about 10 minutes to register or so, and then the test is about 10 minutes as well. So they're really, really quick and easy. We do them kind of all day, every day, so there's no serious restrictions on when you can do that. It's just easy. We try to make it easy. So, the hospital used to be on banker's hour, so you had to take off work to do this. But there are so few days that you get off, and families look like soccer practice and band practice and kind of all those things. So we want to make it easy for you. So that's what we've done.
Fantastic. Well, and I don't know, just to touch on this a little bit more, just what the procedure looks like again, in case someone's just tuning in.
Sure, absolutely. So it's a CAT scan. So if you've seen the big medical shows and such, it's the big donut, right? So it's going to ask you to hold your breath a couple times. There are no IVs. It doesn't hurt. That's about the extent of it. So we put some EKG leads on. You slide back and forth through that donut 3 or 4 times, and you're finished. The work happens once you're actually finished and gone. Then we do the workup. So we start scoring what type of calcium is in those vessels, any blockages, anything to that effect. We do that, and then it goes to the radiologist for their read as well. And then any abnormalities go to the cardiologist, so they can kind of get you set up wherever you need, and recommendations there as well. So it's just easy. That's the main point that we try to make. We make it easy.
Well, it's great for folks to know that, and really, because I'm one of those people that I can find every excuse not to go do something, and just knowing that it really is, that non-invasive and really just that easy to schedule and just efficient too. That's great.
And the piece of not hurting, it also doesn't hurt monetarily. It's about $120, so it's cheap.
Well, and really, one can make the argument it's really a priceless thing, because it's so important to really know where you stand, because you don't know until you know.
Correct.
Yeah. And I think, we've got a couple of testimonials of some patients that, that we were able to identify a high risk, and then we were able to set up their procedure in the cardiac cath lab and intervened and gave them a new lease on life.
Well, and so that's actually great to touch on real quick before we wrap up with the walk here. So if you do catch something, is that what happens? Is there's just a procedure at that point that you got a protocol to follow?
And that's where we, our collaboration is so important. It's something as simple as a phone call and say, hey, I've got to, let's get this set up. We get them in with the cardiologist. We'll set up their procedure. Depending on symptoms, how soon we need to get them in, and go on from there.
It's just incredible.
It's great continuity of care. I mean, we can go directly from CT into cardiac, catheterization or stents or whatever is necessary. We've got all the physicians here. You don't have to go across the river. It's just we've got all the specialties here, and it's funny. We speak to the doctors specifically, and they tell us that our equipment that we have invested in is even better than what you get across the river.
Yes.
So the old adage that you have to cross the river to get great care is 100% wrong. We've got newer equipment with better technology than even they do there.
Fantastic. Well, I completely agree. Just here, and I know nothing about medicine, I'll be honest with you, besides what you guys send me, but reading the articles and just seeing some of the testimonials that are attached to those too, it's just incredible, all across the board from all different departments too within OSF. And before we wrap up today, it's 9:31, but take me through how you're finally, lastly, I guess, raising awareness for Heart Awareness Month.
Yeah, so every year the American Heart Association puts on the Heart Walk, which is, nationwide, but here in St. Louis, this year it'll be May 30th at Westport Plaza. And so St. Anthony's, we couple years in a row now have had a team that we do some fundraising to raise money for the American Heart Association. But then the big bonus is on May 30th, we get to all get together and walk for one purpose, which is just raising heart awareness for those affected.
How do I join your team?
So we can add the team flyer. We've got a QR code that you can sign up.
Yeah, send it to us. We'll attach it too.
Absolutely. And all donations are welcomed.
Oh, fantastic. We'll make sure that we link everything in a write-up on RiverBender.com. Quick quick question, Fred. I seen these. I gotta ask you because I was gonna ask you last time. I completely forgot. This is a CJ question. So I've seen these videos. Can this happen where like a piece of metal is like in a room and it gets sucked into the machine? Because I've seen these all over Facebook, and I don't know if it's AI or if that's really a machine at work.
So it's real. So that is MRI specific. So magnetic resonance imaging. They're very, very powerful magnets. So you think of your refrigerator magnet, right? That's a permanent magnet, and it kind of pulls. This one can pick up your car. So truly it is dangerous. That's why we are so safe. Everyone's screened before they get close to the room. There's 4 separate zones that you have to go through. It's a very, very it's a great diagnostic tool, but it's something that you have to respect because it can be very dangerous. Man. So the videos that you see, there are probably some that are AI, but many of those are real.
This would be a missile.
It would be. Yep.
Wow.
Absolutely.
Well, I'm glad we touched on that just to talk about your guys' safety protocol, too, the 4 steps, and really just touching on that, too.
For sure.
Thank you guys so much, as always, for stopping by.
Thanks for having us.
9:33, a little bit of change. We're going to be talking to Alice & Co. in just a couple of minutes. Striding and Surviving, a great organization. We'll get all the details on upcoming fundraisers and ways we can support them. Oh, real quick, OSF, got to brag about you guys. So I told you that my daughter was sick over the last week, and, my weekend was a little bit different, but that's okay. That's what it's all about. We realized on Friday, it just was time to take her into an urgent care. We called the doctor. That was kind of the best thing to do, just to get seen. And we were going to go to an urgent care, but it was just, we were going to have to wait till 7 p.m. and it was 10 a.m. on a Friday. And it's like, we don't have that time. And I went, CJ, what the heck are you doing? Go to OSF on Godfrey Road. I really did. I even said that in the car. We went right down, and you guys took care of us so quickly. It was the first time we took Estella in there. But just the care that we got, everyone that we talked to was great. And, tested her for RSV. She was positive, but then we got the note, hey, she'll be good by Monday. She's on the tail end of this. And it's just knowing, and really just getting seen quick and really being what prompt care is. Prompt and right there, and really just another great thing. So if you're sick this flu season, cold season, or if your child is unfortunately sick this RSV season or bug season, make sure you go and check out OSF Healthcare Prompt Care Office on Godfrey Road. They'll take care of you like family, and don't forget to tell them that